Hey everyone, this is Rick MacDermid here with Senior Solutions Group, and thank you for checking out this video. Today we're going to talk about understanding Medicare in 2022. And for those of you who are watching our video for the first time and haven't subscribed yet, feel free to subscribe to our channel. And so let's get started. So my name is Rick MacDermid. I've been working with seniors since 1995 and love helping people. The main reason we do what we do is we love helping people. A lot of people get bombarded with ads on TV and clutter in the mail and don't know how to make heads or tails over it. And the Kaiser Foundation did a study back in 2018. They found that the average person on Medicare spends $6,150 on their health care expenses each and every year. So if you're married, you can multiply that by 2. And a lot of people are on fixed incomes. You might have an income of maybe $1,500 a month, maybe less, maybe a little bit more, maybe $2,000, maybe $3,000 a month. If you're on a fixed income and you make the wrong decision, it can really impact your life in many, many ways. Even if your income's higher, healthcare is expensive, and we want to just make sure that we do our dead level best to make sure you're informed and updated. Whenever we take on a client, we offer our service for life. That means that we are here if you need us. You don't need to call some wonky phone system, some 800 number, and talk to someone you've never talked to before. They don't know you from Adam. We are here for our clients, and not only for our clients, but for our clients' family members as well. So we just want to be available to you and make this as a resource for you, to reach out to you, to help in any way we can. Medicare can be very confusing. We're going to try to make it a little bit less confusing. I can't promise that you'll remember everything that you see on this video, but if you can come up with or remember 1 or 2 items that help you, we feel like we're doing our job. So we're going to talk about how to enroll in Medicare, when you should enroll in Medicare, what Medicare covers, how to fill in the gaps, and how to choose the right plan for you, because each person is different. This is not a one-size-fits-all solution. I know those commercials on TV sound like there's only one way to go. There are 2 sides to the coin, so we're going to talk about both sides of the equation. So, should I sign up for Medicare Part B? So there's 2 main parts to original Medicare, Part A and Part B. Part A is the free part. That's the hospital insurance part. Typically, there's no charge for Part A, so when you're turning 65 and you are wondering, should I sign up for Part A and or Part B of Medicare, I typically advise people to sign up for at least Part A benefits because they're free, unless there's one caveat: you have a health savings account. If you sign up for Part A and or B and you have a health savings account, you must discontinue your contributions to your health savings account. But most people don't have health savings accounts, so I typically advise people turning 65 to at least sign up for the free part of Medicare, which is Part A benefits, which is hospitalization benefits only. So if you don't have employer insurance, so some people are already retired prior to age 65 and are already drawing Social Security benefits, those people will automatically get a Medicare card in the mail. So you don't have to apply for Medicare. If you don't have employer insurance, though, and you're turning 65, then you're probably going to want to apply for Medicare Part A and Part B. You may elect to not have Part B if you're on the VA. We have clients that are on the VA. Some have elected to have Part B, some have elected not to. So it's really up to you as far as your personal preference. So if you have employer insurance, then you may want to delay Part B, and contrary to what your friends may be telling you, there's never a penalty as long as you have credible insurance through an employer or through your spouse's employer. So if you're on your spouse's health plan through their employer and it's credible coverage, then there is no penalty for delaying Part B. So you could work into your 80s if you want to, and we've had clients that have done so in the past. So you can work as long as you want, as long as you have employer insurance. There will be no penalty for delaying your Medicare enrollment. So if you don't have insurance, you probably want to apply for Medicare leading up to when you turn 65. Or if you're disabled and you've been on Social Security disability for 24 months, you will automatically get Medicare as well. If you have employer insurance and it's credible and you're not getting charged an arm and a leg, then you can work as long as you want and not have to worry about signing up for Medicare Part B. Now, if you're paying a lot for your health plan through work, you may decide that you do want to add Part B. Also, if your employer has fewer than 20 employees, they may require that you apply for Medicare Part B. So just be advised about that as well. So again, to reiterate, enrollment is automatic if you're already on Social Security and already drawing benefits. It's not automatic if you're not on Social Security. We advise you to apply online, not call the 800 number, because right now, especially with the pandemic, we're getting multiple reports of people sitting on hold and being hung up on by Social Security. So you can check out our other video on how to apply for Medicare, and we can walk you through that step as well, through the process. So the other option is to go to the local office if and when they ever open up again. So the best option is to do it online. The Medicare card will look like this. It'll be a red, white, blue card. It'll have your name on it, and it'll have the effective dates on it. And the back of the card will have the option of refusing Part B of Medicare. So if you get a Medicare card in the mail and it has Part B benefits and you don't want to pay for Part B, you got to make sure that you're very careful about this, because you need to have credible coverage to avoid the penalty later on. You can refuse Part B and have Part A benefits only at no cost to you. Now, there are different enrollment periods, and there are 3 categories we're going to focus on today. The initial enrollment period is a once-in-a-lifetime event, which typically will happen if you're turning 65 3 months prior to your 65th birthday. So if you're born in January, your effective date to apply for Part A and B would be October 1st through November, through all of December. So we advise people to get a head start. So earlier the better. October 1st would be the earliest you can sign up, unless you're born on January 1st, in which case you would have the month before your birthday month to be eligible for Medicare. You would be eligible for Medicare December 1st if you're born January 1st. So if you're born February 1st, you're eligible January 1st. So you can move up that 7-month window 1 month early if you're born on the 1st of the month. But for most people, 1 in 30 people will have been born on the 1st. Most of us that are not born on the 1st, it will take effect the first day of your birthday month if you so choose to apply for Medicare. So your initial enrollment period happens once in a lifetime. You have 3 months grace period. So if you're born in January, you have the month of February, March, and April. On May 1st, you are out of luck. Unless you have an employer plan, then you can apply for Medicare Part B at any time with no penalty. So we've had a number of people that have missed the deadlines, and they call us in a panic, don't know what to do. It's like moving heaven and earth if you miss these cutoff deadlines. And no one from the government's going to hold your hand. You can read this Medicare and You book and learn all about it, but no one's going to call you from the government and tell you you must do this by this date. It's up to you to take the bull by the horns. The annual enrollment period, which we just got done with a couple weeks ago, is a once-a-year event which goes from October 15th through December 7th, Pearl Harbor Day, each and every year. So during this time frame, if you're on a Medicare Advantage plan, or if you're on Original Medicare, and we'll talk about what those are in a little bit here, or if you're on a prescription drug plan, or if you want to enroll in a prescription drug plan, you can do so during these dates. And it's more of a free-for-all period. You can change your mind as many times as you want during this time. So if you talk to Joe Namath, and you can check out our video on these Joe Namath ads as well, you feel like you've made a bad decision, you have until December 7th to change your mind. And then there's another 3-month period where you can change your mind one more time if you've signed up for a Medicare Advantage plan and you're not sure you want to stay on that plan for the remainder of the year. That goes through the end of March each and every year, but that's only for people on Medicare Advantage. So it's a Medicare Advantage open enrollment period which goes from January through the end of March. For most people though, the annual enrollment period is when you will want to review your plan, make sure your prescription drug plan hasn't changed. The drug plans and the Medicare Advantage plans by law are required to send you an annual notice of change, which would come to you before or around October 1st at the latest. Too many people that we've talked to disregard those letters and they don't look at them. They don't realize that their premiums have gone up, maybe double or triple or quadruple, or a certain drug is no longer covered. So if you're on an expensive drug like Eliquis, you really want to make sure you review your plan. If you're on generic maintenance drugs, but your premium has gone up 2 or 3 times, that's again that Kaiser study that said people are spending $6,150 on their health care back in 2018, and it's only gone up since then. If you don't take the steps to review your coverage, you could end up overpaying by maybe just $100 or $200, which could make a difference, maybe $400 or $500. We've met with people this last open enrollment annual election period where we've been able to save people up to $5,000 just by reviewing their drug plan because they never heard from their agent that signed them up for that plan years and years ago. So they're paying over $100 a month on their drug plan and maybe up to $300 a month on their supplement plan. Just by making some tweaks, we were able to save them thousands of dollars on their refills, on their insurance costs, without changing their doctor, without incurring hospital bills. So there's a lot of things you can do during the annual election period that can really save you money. Now, there's another period which is multiple incidences which could trigger this. If you move out of state, if you go into a nursing home, if you become eligible for Medicaid, if you're incarcerated there, or you're released from incarceration, that would trigger what's called a special enrollment period. So we've had clients that have moved from one area to the next to be with their grandkids. They have to change their plan. Then the grandkids grow up, they move back. We even had a client that bought their old house back. They had 2 special election periods, one when they moved away and one when they moved back, where they were required by law to change their plan. So during this period of time, you have the ability, and sometimes you are required to make a plan change. Those are the enrollment periods. During the annual enrollment period, which is this middle period here, that's when you see all the ads on TV really ramp up. Now we're seeing more and more of these ads go year-round as these telemarketing companies are trying to gather names for the annual enrollment period so they can bombard you with phone calls or emails during the annual election period or leading up to it. So just be aware those ads may not stop. They may go year-round, but they really ramp up during the fall annual enrollment period. Sometimes when you call those 800 numbers, you may be talking to someone that's brand new to Medicare, just got their credentials, just got licensed, maybe looking up your zip code for the first time. So if that's your cup of tea, be our guest. Feel free to call those 800 numbers. But if you want someone that knows you, someone that's talked to you, that knows your situation, that knows what's important to you, that has talked to you, that has been there for you, feel free to reach out to us at Senior Solutions Group or to your local agent or to your agent if you have one that's helped you. And don't be afraid, you're never bothering us, and hopefully if you have an agent, your agent will feel the same as well. So again, it's very important to maximize the benefits that you're entitled to. When you retire and you're past age 65 and you've had employer insurance, you have an 8-month grace period to enroll in Medicare Part B without being penalized for the rest of your life. Now there's a 10% penalty for each year that you do not enroll in Medicare Part B. And that will be added on to the Medicare premium, which is going up significantly as we speak for 2022. So we're going to talk about that in a little bit. So again, costs are going up, so it's more critical than ever to review your options and make sure you're not overpaying. So there's four main parts to Medicare. There's Part A and B, which are the original two parts of Medicare, started up in back 1965. President Harry Truman was the very first enrollee in Medicare. There he is, President Truman. And he's one of the founding fathers of Medicare. It was his passion to have a healthcare system for seniors, so he was the honorary first beneficiary with Medicare. And that's a little known fact, but it's kind of a cool fact. Part D, which was added in 2006, is the optional drug coverage if you want drug plan insurance through a standalone insurance company which is approved by Medicare, but it's not paid by Medicare directly. So that is a private insurance company which would offer Part D drug plans. Most counties in the U.S. have about 24 drug plans to pick from. So they're all listed in this book here, the Medicare and You book. What we found is people get confused when they get to the back of the book. There are about 2-3 dozen pages of different plans to pick from. It can get really overwhelming. So we have some tools on our website at seniorsolutions.net, or you can use medicare.gov as a good tool as well to understand what your options are for Part D drug coverage. Again, you really want to make sure you're reviewing your options. The deductible for Part D is going up significantly in 2022 from $445 up to $480. We're seeing cost of copays go up. People are paying more for their medicine and taking fewer medicine because of it, and so that's not good. So if people can reduce the costs on their plans by taking the time to review your options, not just look at one company's plan because company XYZ sent you their mailer promoting their plan only, not promoting all plans to compare side by side by side. So we're not going to show you one plan or compare one plan. We're going to give you an overview of how it all works, and because everyone's situation again is different. What is Part C? Part C is a Medicare Advantage, which is an alternative to traditional Medicare. What that basically does is it combines Part A, Part B, and usually Part D together under one simple plan. So these plans are different from using traditional Medicare, where under original Medicare, you can buy a supplement and have a Part D standalone drug plan. With a Medicare Advantage plan, you would basically put your Medicare card in hibernation mode. So Medicare would be deactivated itself, and you would have a replacement card which would pay your hospitals and your doctors and usually your prescription drugs as well as additional benefits that are not covered by Medicare, such as vision and dental, etc., etc. Part A is usually free as long as you work the required minimum amount. There's no cost, and it would cover an inpatient stay in the hospital. So Part B is the part that you have to pay for, and it's usually $170.10 a month. So we saw a 14.55% increase on Part B premiums for 2022. Part of that, there's a couple reasons for that, for the big increase. One is the government is trying to recoup their losses from 2021 with the pandemic, where they only raised Medicare rates $3.60 from 2020. So they're trying to get back what they lost from 2021. Also, there's a new drug for Alzheimer's, Aduhelm, put out by Biogen, which is a controversial new drug that the FDA barely approved. Members of their scientific panel disagreed in approving this drug. The cost of this drug is $56,000 per person. Medicare is the government's trying to have a reserve amount in their reserves to pay for this drug. So some Alzheimer's advocates and consumer advocates recommended this last week that the FDA pull this drug, and Shazam, Biogen, the maker of this drug, offered to reduce the cost in half, down to about $26,000. Imagine that. Anyway, that's one of the reasons for this big increase in Part B premiums for 2022. Hopefully there will be some intervention. So when you see this video, maybe the Part B premium will have been reduced to maybe a 5 or 6% increase instead of a 14% increase for 2022. So we're always wanting to keep our clients in the know, and we have several videos on our YouTube channel. If you want to check those out at your leisure, feel free to do so. So Part A covers inpatient care and skilled nursing care. Skilled nursing care would be typically in a skilled nursing facility like a nursing home. Medicare doesn't cover long-term care. It only covers short-term rehab visits in the nursing home, and we'll talk about that shortly, as well as some limited in-home care and hospice care if you're terminally ill. So again, Medicare does not cover custodial long-term care. It only covers short-term care. So Medicare will cover up to day 60 in the hospital as an inpatient. So it's very important that you ask the doctor or your provider, am I an inpatient or am I being kept for observation? If you're being kept for observation and you only have Medicare, you will pay 20% of the bill. Ouch. So if you're on Part A benefits, your bill would be limited to $1,556, which is the Part A deductible, which is per occurrence or per hospital stay, as long as it's not within 2 months. So if you're in the hospital and you're discharged within a week or two, or maybe a month, typically you will not have to pay another deductible. But if you're discharged and 2 months later you go back to the hospital, you would have to pay the $1,556 deductible. In 2021, the deductible is $1,484, so it's going up to $1,556 in 2022. Again, we're seeing costs continue to escalate year after year after year. When I first started doing Medicare planning, the Medicare premium was around $43 a month. So now we're up to $170.10 for Part B premium alone. So this deductible for the hospital would not include if you have to get to the hospital by ambulance. So if you're call 911 or your spouse calls 911, or if you're out in the woods camping and you need to be medevaced, that would be under Part B, and that's a separate expense, and we'll talk about that in a second here. Now, what if you're in the hospital longer than 60 days? If you only have Medicare, you could pay another $11,670 out of pocket. But if you're in longer, you have an extra 60 days to use once per life, but your bill would be $46,680 if you're there for the full 150 days, or if you use your lifetime 60-day reserve amount. So you would have to pay the deductible for the first 60 days, for the next 30 days, and as well as the next 60 days. After that, you're on the hook for the whole bill. So things like heart transplants might necessitate a long hospital stay. Typically, most people aren't going to spend more than a week or two in the hospital, because the hospitals have a set amount of dollars they get reimbursed from Medicare depending on what illness or what injury you're in the hospital for. So their objective is to discharge you as quickly as they can so they don't have to lose money, because their earnings are capped based on what you're in the hospital for. So if they can discharge you a day earlier, they get to keep the full amount of payment from the government. It's called a DRG, Diagnostic Related Groups system setup that was set up in the early 80s under Graham Rudman, for those of you policy wonks out there, which are probably not many of you. So if the hospital has to keep you longer, then they have to eat the cost. So their incentive is if they can discharge you and you're healthy enough, or if you're stabilized enough to be discharged either back home or to a skilled nursing facility, they're going to discharge you as quickly as they can. Now, the problem for the hospitals is if they have to readmit you, and they have to do that for many people, they can get fined by the government. That may be one reason why we're seeing more people or more hospitals keeping people as an outpatient rather than as an inpatient. Therefore, they don't have to count it as a readmission if you have to come back to the hospital later on, and they can avoid penalties from the government. So now if you're discharged from the hospital, then you may need more care if you have a heart attack, cancer, a stroke, a major hip replacement, hip fractures. You may need to get physical therapy or speech therapy or inhalation therapy, occupational therapy in a skilled nursing facility or a nursing home. Now, the nursing home, I was a social worker in a nursing home back in the early mid-90s, and there was a separate wing for people on Medicare versus the rest of the population, which are there for long-term care. The people there for short-term care are in a special Medicare designated bed, and you have to meet all the Medicare criteria to get those benefits. The main criteria is, first off, you have to have spent at least 3 days, or actually 3 nights, in the hospital as an inpatient, not just for observation, but 3 nights as an inpatient. After that, Medicare will pay the first 20 days as long as you meet the Medicare criteria. So if you're progressing in your therapy, if you're not refusing therapy. So that's a biggie. If you have a loved one and they're refusing care, Medicare can't cover their care, and they will be turned over to private pay, where they would have to pay the whole bill themselves. So if you're in the skilled nursing care and you have a loved one, or you're in nursing care, don't refuse care, because you'll be kicked off of Medicare. That's very important. Now, if you're continuing to progress and making headway, Medicare will cover an additional 80 days. However, you are responsible for the co-insurance, which is going up to $194.50 per day in 2022. So you could pay as much as an additional $15,000 plus on top of what you paid for the hospital if you only have Medicare. In other words, you have elected not to have a Medicare Supplement plan. So if you just have red, white, and blue Medicare only, you would be responsible for that amount, as well as all the hospital bills, plus 20% for the ambulance, 20% for the emergency room, and for all the doctor care. It can really add up. Again, it's very critical that you know your options, and you have someone that you trust that you can talk to about this, that is competent and has been helping people, not as an ancillary business. In other words, they do car insurance, homeowners insurance, they do all of it. They're experts in every type of insurance. Find someone that really specializes in Medicare to get the best advice. By the way, we don't do car insurance, we don't do homeowners insurance. We specialize in retirees and pre-retirees. It's what we do. So we're kind of a niche within a niche, so to speak. So Medicare Part A also covers hospice. So if you're terminally ill and your doctor has certified that is the case, then Medicare will cover hospice care as well. Part B of Medicare is what is used most often by people on Medicare. So that would be if you need to go to a doctor appointment, if you need to get your labs done, or if you need to go in for a same-day surgery, like a shoulder or maybe even a knee, or if you need chemo, radiation, or this new Alzheimer drug, which is supposedly going to be covered by Medicare, knock on wood, unless they pull the plug in 2022. Those are types of drugs that are covered by Medicare Part B. So radiation, chemo, this new Alzheimer drug, infusion care would all be covered under Part B of Medicare. Medicare Part B does not cover routine vision or hearing, doesn't cover hearing aids, it doesn't cover dental. So that's something you need to be aware of. Medicare A and B covers hospital care, skilled nursing care, in-home care for rehab purposes, hospice care, as well as outpatient care such as doctor visits. And there is a cost for Part B, and it's going up significantly as we speak unless the government intervenes after we make this video. So it's scheduled to go from $148.50 up to $170.10, which is that 14.5% increase for 2022. Unless your income is higher, so based on your 2019 tax return, the government will look at your tax return and determine if you have to pay more for Medicare. So be advised, you may not only pay more for Medicare Part B, but also more for Medicare Part D drug coverage. So that might determine your decision whether to continue to work or not. You might decide, I don't want to pay $544 for my Medicare, not only for myself, but for my spouse. So that might be something you need to be aware of if you're making a higher income. Now, there is a petition form. If you've had a drastic change in income, if you were laid off, you can appeal that. So just be aware of that as well. So if you've had a major change in income, you can appeal that adjusted amount that you would have to pay for Medicare based on your income. Once you're on Medicare Part B, Medicare will pay after you've met the first $233 deductible, which is changing from $203 in 2021 up to $233 in 2022. After that has been met, you would pay 20% of what Medicare approves of the bill. So if the bill, you know how when you go to the doctor and you get a thing in the mail that said that you had a procedure done, maybe a surgery, and the bill they submitted was $20,000, and then the insurance or Medicare chops it down. It might be $8,000 that Medicare approves or $10,000. Medicare would pay 80% of what they approve of that amount, not of the full amount. So Medicare will pay 80% and your responsibility is 20%. However, unlike traditional health insurance like Obamacare, there is no out-of-pocket maximum with Medicare, with original Medicare. So if you have a heart transplant or have a major illness, a cancer treatment, and you need a lot of care, you might be in and out of the ER several times during the year, you might end up getting bludgeoned by these bills that come in if you only have Medicare. Because 20% of what? Is it 20% of just one doctor visit, or 2 or 3 doctor visits, or 20% of a major surgery or major surgeries, plural, that have to happen? So just be advised, or if you're on one of these expensive drugs, these outpatient therapy drugs that have to be done at a clinic, you're going to pay 20% of the bill. So just be advised that if you don't take action and you just sweep this under the rug or sweep it under the bed and don't know what your options are, you could end up hurting yourself financially. And it financially also can affect other things as well. If you're having to pay more for your medical bills, maybe you're going to take less of the medicine you need to take. So take the bull by the horns and reach out to your agent or to us if you'd like to talk to us, and we'll be happy to talk to you about your options. There is no foreign travel under original Medicare, but some Medicare Supplement plans and some Medicare Advantage plans will cover foreign travel emergencies. So be aware of that as well. So here's the step-by-step chart that we often use for people who come to us for help. We try to keep this simple because more often than not, we talk to people that call some 800 number, respond to something in the mail, and call some person that looks up their zip code for the first time ever. They may be brand new to Medicare, newly licensed. They end up getting more confused than they were before. We're going to keep this simple. You have 2 ways to get Medicare. Option 1 or option 2. Option 1 is the traditional route. Option 2 is the Medicare Advantage route. So if you don't mind paying a higher premium and you want more predictable cost, you don't want hospital bills, you don't want uncertainty, you can get a Medicare Supplement plan and keep that plan for the rest of your life if you're happy with it. By law, you can never be canceled as long as you make your premium payments. Now, you're going to pay a higher premium for a Medicare Supplement plan, but you're going to be able to go to any doctor anywhere that accepts Medicare, anywhere in the U.S. No referral needed unless the doctor requires it. So a lot of people like certainty. They don't want the unknowns, and they're willing to pay more for it. And these are the people that don't want the extra benefits like dental, vision, hearing that Medicare Advantage, which is option 2, offers. Now, Medicare Advantage is an alternative. It is growing in popularity, partly because we're seeing increased costs with Medicare. That $170 premium may force people onto Medicare Advantage, not because they want to, but because they have to. So if you're on a very tight fixed income and you might say, yeah, Medicare Supplement plan, yeah, that's kind of spendy. you could look at a Medicare Advantage plan and have some additional benefits that are not included with regular original Medicare A and B, such as vision, dental, and hearing. Also, the Medicare Advantage plans will cover prescription drug benefits in most cases. Now, if you're on a Medicare Supplement plan, you have the option of adding a drug plan a la carte. And the nice thing about that is you can customize it. So what do we mean by that? You can actually review your drug plan every fall between October 15th and December 7th. Now, the standalone drug plans, this is a secret, are going to change more than the drug plans that are built into a Medicare Advantage plan, because these standalone drug plans have less funding than the Medicare Advantage plans. The insurance company has less profit margin, so they may change the premium. It might be like the frog in the boiling pot of water. Slowly but surely, your rates are going to go up each and every year. If you don't take the time to review your option for your prescription drug plan, the cost will creep up on you. So if you're on a regular standalone Part D drug plan, it's very important that you review your drug plan on an annual basis. The Medicare Advantage plans would have a lot more to lose if they were to raise your copays, but it does happen where the drug plans can change on the Medicare Advantage plans as well. So it's also important to review your drug plan on the Medicare Advantage plans. Also, it might be that your pharmacy either goes out of business. We're seeing more mom and pop pharmacies go out of business, or some of these smaller chain pharmacies go out of business. So we're seeing more people getting forced into Walgreens, Safeway, Kroger, Walmart. Those types of pharmacies are getting the lion's share of the business for Part D drug benefits. So it's very important that not only that you know your drugs, but you know what your pharmacy options are. And we have a process for that to help you with that as well on our website at seniorsolutions.net. Or again, you can use medicare.gov as a resource. So Medigap, also known as Medicare Supplement insurance, is sold by private insurance companies. It works only with original Medicare, and they don't include drug coverage. And these are the 10 plans that you can pick from. Of those 10, if you're new to Medicare after 2020, plans C and F, which are the all-you-can-eat buffet plans, I like to call them, where it pays everything from day one, no deductible, no co-pays whatsoever. You just show your Medicare card and your insurance card and shazam, there's no co-pays. The government said no more of that. Starting in 2020, you have to at least pay the Medicare Part B deductible, which is going up in 2022 from $203 up to $233. After that, you can get Plan G, which is the closest plan to C and F. With Plan G, there's no networks, there's no referrals, you pay the deductible, and after that, you pay zero as long as Medicare pays their portion. Same coverage nationwide. It has emergency foreign travel benefits. You can choose any drug plan you want if you have a Medicare Supplement plan such as Plan G. Typically, there's no additional gym, dental, or vision benefits. On a few plans, they do have gym benefits. In our state, in Washington, though, there is a big gap between Plan G and Plan N from a premium or a cost perspective. So we're having people compare Plan G to Plan N each and every time we talk to people in the state of Washington. In other states, the gap isn't very big, and we are licensed in multiple states, but in our state, our home state of Washington, there is a big gap between Plan G and Plan N cost-wise. We're really finding a lot of people gravitate toward the Plan N because the benefits aren't that different from Plan G. The main difference is with Plan N, you may pay a $0 to a $20 copay when you go to the doctor, and up to $50 when you go to the ER once your Part B deductible has been satisfied, which is $233 in 2022. The other difference between G and N, which doesn't happen very often, is you may go to a doctor. Nationwide, about 2% of doctors accept Medicare partially. In other words, they've partially opted out of Medicare. They'll bill Medicare, but they'll charge an additional excess fee of 15%. Some states like Minnesota have outlawed that. So if you go to the Mayo Clinic in Minnesota, you will not be charged an excess fee in Rochester, Minnesota. But if you go to the Mayo Clinic in Phoenix, they have not outlawed it, and you would pay an excess fee of 15%. If you have Plan G, you wouldn't have to pay the 15% excess fee. Under Plan N, you would. We don't see it very often. I've had very few clients say we have to pay excess fees, but there's a slight chance on Plan N that you would have to pay that excess fee. In the state of Washington, you can always switch from N to G, but we very rarely have ever had to do that for clients. There's also a high deductible option for Plan F and or G. So if you want to pay the lowest premium possible and have Medicare Supplement insurance, you don't mind a higher deductible, then you could look at a high deductible Plan G or Plan F as well. So the Medicare Advantage plans replace Medicare. They cover your medical care, usually your prescription drug coverage, as well as additional benefits like vision, hearing. There's one plan that'll even give you a mechanical robotic dog if you can't have pets where you live. So a lot of innovation. There's a lot of advertisements on TV, and a lot of people sign up for Medicare Advantage plans without really understanding them. So we really want to make sure we take the time to look at the big picture and how they work, because you may end up with more copays, sometimes a lot more copays, and maybe more prior authorization requirements on a Medicare Advantage versus being on a traditional Medicare. And you also want to make sure that your doctor's in network, even if it's a PPO plan, not just the HMO plans that require you to stay in network. So we have some videos on the pros and cons of Medicare Supplement and Medicare Advantage plans if you want to check those out as well. We really want to make sure we educate you and inform you. We're not here to sell you. We're not here to tell you this plan's better. We're here to let you know how they work and what your options are. And we're here to follow up with you as the years go by. So our work only begins, it doesn't end when we help you enroll in Medicare and or help you select a plan. Very important for people to know as their needs change. We're here as your needs change as the years go by. So to be eligible for Medicare Advantage, you must have both Part A and B of Medicare. You can't have Part A benefits only. You have to have both Part A and B. And the premiums will vary from plan to plan. Coverages will vary. And with a Medicare Advantage plan, typically you're going to have an out-of-pocket maximum, which could be anywhere from $3,000–$4,000 at a minimum up to as high as over $10,000. So be aware, if you go out of network and you're on a PPO plan and you get cancer, you may pay up to $10,000 out of pocket for your treatment. And if it happens in November, December, and it bleeds into January, February, you might have to pay that times 2. So just be aware of that. You might save a lot of money on Medicare Advantage, and if you stay relatively healthy, you could save a ton of money and get some extra perks. But if you have a Medicare Supplement plan, you're going to pay more in all likelihood over the course of your lifetime for the premiums. But you're going to sleep well at night knowing that if I go to the hospital, I'm never going to have to worry about hospital bills. And I can go to any doctor that accepts Medicare. So there's a trade-off. There's a pros and cons to both. So there's different types of Medicare Advantage plans. There's HMOs, there's PPOs, special needs plans. So the HMOs, you must stay in network unless it's an emergency. You have to go to the plan doctors. PPO plans give you more flexibility. You can go out of network, but you're going to pay less if you stay in network. With a special needs plan, you must either be diagnosed with an illness such as diabetes or in an institution such as a nursing home or assisted living. So the last part we're going to touch on is the Part D drug benefit. You may pay the standard premium if your income is below these amounts here, based on if you're single or if you're married, based on your tax return from 2019. You may pay more based on your income, so just be aware of that. And if you wait to enroll in Part D, there is a 1% penalty for every month you delay your enrollment. So you have that 7-month window when you're brand new to Medicare to apply for Part D drug coverage unless you have credible drug coverage. It's very important that you compare plans side by side. Don't just sign up for a plan because they sent you a flyer in the mail. So if one plan says, we've got this plan, we've got that plan, we got that plan, that might be that's what they have, but it's important to compare all plans side by side, apples to apples. It is voluntary. All plans must be contracted with CMS, which is the Center for Medicare and Medicaid Services, and they must meet Medicare minimum standards. So even if you sign up for the least expensive drug plan, they have to cover at least 2 drugs in every category that Medicare approves. So you're not going to get a bad plan if you find a plan that doesn't cost very much. Vice versa, if you pay over $100 a month, you're not going to be getting a plan that's 80 times better than the one that's $10 a month. That's not how it works. So these plans change from year to year, and it's important to review your options on a year-to-year basis. So in 2022, the deductible is going up significantly, up to $480 from $445. Most plans will exempt the deductible if you're on inexpensive Tier 1 or Tier 2 generic drugs. Now, there's a coverage gap, which that is another term for that is called the donut hole, which in many ways it's been eliminated, but it's still there. So if you have a cost of drugs equaling $4,430 for the year, you're going to have to pay 25% of the bill for that drug. So if the cost of the drug is $100, you would pay $25 while you're in the coverage gap. So if the cost of the drug is $200, you would pay $50 while you're in the coverage gap, where before you hit the coverage gap, you might have only had to pay a $20 copay for that drug. And then once you hit the catastrophic phase, you would pay 5% typically until the year ends, and then it would start all over again in the following year. So this coverage gap is the coverage gap. It doesn't matter what plan you're on. There may be some plans that will cover generic drugs in the coverage gap, but typically when you're in the coverage gap, you're going to pay these fees just like you would on any plan, no matter what plan you're on. So if you're on expensive medications, that would affect you versus someone who's only on generic drugs, where this typically would not affect those people. It gets very confusing. I'm not going to try to confuse you any more than you probably already are. If you've got questions about the coverage gap, or if you're on expensive meds, reach out to us and we'll be happy to follow up with you. Now again, we can't change your drug plan in most cases until October 15th through December 7th if you're already on Medicare. But if you're new to Medicare, you have 3 months prior to your Medicare effective date to review your options, your effective date month, and then 3 months after your effective date. So that's going to wrap it up today. We're going to skip the rest of these slides here. You can call 1-800-MEDICARE. You can go to medicare.gov. Feel free to reach out to us. You can apply for low income if you're on a lower income, and we can help with that often to help save money on your prescription drugs. There's low income subsidies. If you meet the criteria, we can help you research that to find out if you might be eligible for low income extra help, or even for Medicaid assistance as well. Feel free to reach out to us. We're here for you. We love what we do. That's why we do it. And you're never bothering us, even if you have a question or two. It may seem like a simple question to you, but we're here to help any way we can. Senior Solutions Group. And again, feel free to subscribe to our channel, and thanks for taking the time to watch.